Hi everyone, in this video let's talk about budesonide. Budesonide is one of the medications that is classified as a glucocorticoid. By inhalation route, it is mainly used for the management of asthma, as a prophylactic. It can be used both in the adults as well as in the children. It is available as a solution for nebulization and powder for inhalation. In this video, we are going to discuss essential things that are required to know before the use of budesonide, like how this medication works, how to take this medication, and what the important precautions and side effects are. How it works. Budesonide reduces the inflammation in your bronchioles. It acts as an anti-inflammatory corticosteroid. It has potent glucocorticoid activity, which reduces inflammation. Budesonide can bind to glucocorticoid receptors, which are going to be interacting with the DNA in the nucleus. It can increase the production of a few mediators that are having anti-inflammatory activity. It also prevents interaction of a few mediators with DNA that release inflammatory mediators. How to take. Budesonide is available as a suspension for inhalation in the form of respules. They are used for inhalation by nebulization. They are intended to be used in children aged 1 to 8 years. They're available in different strengths, starting from 0.25 milligrams per 2 milliliters. Each respule contains 2 milliliters of solution with different strengths of medication. You can get these respules at a low strength of 0.25 milligrams to a higher strength of 1 milligram. It should always be started with the lowest dose possible based on the age of the children. It can be started at 0.5 milligrams once daily, or it can be given as 0.25 milligrams twice daily. Therefore, the total daily dose is started at 0.5 milligrams. It is also available as flex hauler as an inhalation powder. The inhalation powder can be used in adults and children with an age greater than 6 years. They are designed to deliver a fixed amount of medication each time with single actuation. They are available at 2 strengths, 90 micrograms and 180 micrograms. When you use a flex hauler with a strength of 90 micrograms, it delivers 90 micrograms of this medication with each actuation. For children 6 to 17 years of age, the recommended dose is 180 micrograms twice daily. Based on a requirement, the dose may be initially started even at 360 micrograms given twice daily. However, each dose should not exceed 360 micrograms. In the people with 18 years of age or older, the recommended starting dose is 360 micrograms twice daily. The maximum dose is 720 micrograms twice daily. Pharmacokinetics. Budesonide is mainly absorbed into your lungs through inhalation. However, a small amount of the medication can also reach into your body. This is called systemic absorption. Since this medication is intended for action on the lungs, the systemic absorption of this medication is not essential. However, around 6 to 13% can reach into your blood. Budesonide has a half-life of around 2 to 3 hours, and it is metabolized in the liver by enzymes called the cytochrome P450 system. It is excreted in the urine as well as feces. Precautions. Budesonide, when it is given by inhalation route, can produce few local reactions. It can increase the risk of infections in the nose and pharynx. This medication can be deposited in your mouth and throat, which may reduce immunity and increase the risk of infections. Particularly, it can produce few local candida-like infections. It can produce a condition called oral candidiasis. It is also called thrush. It is produced by opportunistic yeast infections. Candida albicans is one of the organisms that may produce this condition. In this condition, you may have few symptoms like white patches in your mouth and tongue. Soreness, pain, altered taste, and burning sensation on the tongue and the mouth can be observed. Even you may have difficulty speaking and difficulty eating. Therefore, if you observe these symptoms, it may indicate the development of a yeast infection in your mouth or throat with the use of budesonide. In order to avoid this condition, you have to rinse your mouth with each application of this medication. This medication can reduce your bone mineral density after long-term administration. It may increase your bone pain and any risk of fractures if you have any previous risk factors. The risk is more pronounced if you have any previous history of osteoporosis. If you're under prolonged immobilization, like any bed rest or under poor nutrition, again, the risk of reduced bone mineral density may be elevated. Never use this medication excessively for prolonged use. Budesonide can be absorbed into the systemic circulation even if it is given by the inhalation route. Around 13% of the medication is going to be absorbed into your body, and this systemic absorption may produce few systemic side effects of steroids. Particularly when you're using it for a prolonged period, it may reduce hypothalamic pituitary adrenal function. This results in adrenal suppression. The adrenal gland plays an important role under stressful conditions. When your body is under stress, it releases a few hormones like cortisol. They are responsible for increased levels of blood glucose and reducing a few of the non-essential functions in the body. This saves energy, and it even increases the blood pressure, which is required to cope with stressful conditions. On prolonged use, budesonide can produce adrenal suppression, which reduces the ability to combat stress or conditions after the surgery. In such conditions, you may need external administration of systemic corticoids to counteract these conditions. Budesonide is not a bronchodilator. Therefore, it is not suitable for the rapid relief of acute bronchospasm and to treat acute episodes of asthma. In such conditions, you should take short-acting beta-2 agonists like albuterol. They are also available as inhalers and respules for inhalation. Since budesonide is a corticosteroid, it can increase intraocular pressure, and it may increase the risk of glaucoma. Therefore, if you have any previous history of raised intraocular pressure or glaucoma, the risk may be further increased with the use of budesonide. It can also develop the cataracts if repeatedly used at higher doses. When it is used in the children, it may reduce the growth. Therefore, monitor for symptoms of unexpected decrease in growth. Regularly measure the height and weight of the children. Budesonide is metabolized by the CYP3A4 enzyme. Therefore, when you're taking strong CYP3A4 inhibitors like ketoconazole, the levels of budesonide in your body are increased. This may result in the systemic exposure of this medication, leading to side effects. Therefore, check while you take other medications that may interact with budesonide. Few medications like ritonavir, clarithromycin, itraconazole, and sequinavir may increase the levels of budesonide. Side effects. With the use of budesonide, you may get local reactions like runny nose, cough, sneezing, nasal congestion, sore throat, and painful swallowing. You may also have nausea, headache, and oral candidiasis. Back pain and fever may also be observed. You may also get another condition called otitis media. It is an ear infection that results in ear pain, loss of balance, nausea, and vomiting. Since budesonide reduces immunity, it may increase such infections in your ear. When to avoid. If you develop any hypersensitive reactions with the use of budesonide, you should avoid this medication. Budesonide can produce a few hypersensitive reactions leading to skin rashes, urticaria, and bronchospasm. It may also increase the symptoms of cough and wheezing. In such conditions, it should be avoided. This medication may increase the perforation in the nasal septum and may also induce wheezing in the people. In people with status asthmaticus, where a severe condition of bronchospasm exists, this medication should be avoided. These are the important facts about budesonide used by inhalation. With careful monitoring and proper dosage, this medication can be used safely to manage symptoms of asthma. That's all, guys. Thanks for watching this video. Have a great day.